We do not always appreciate the importance of our health until we lose it. When we are told that nothing can be done to heal us, no matter how much money we have, everything that seems so important before now starts to lose its value. We experience pain, desperation, and loneliness in the presence of others. Then we acknowledge that healing is a gift that goes beyond medicine, that there are other options out there that may help us, and that there is a higher power that controls the distribution of this gift. As a result, we hesitantly and somewhat reluctantly begin to explore these other avenues. To our great surprise, we discover the secrets of the universe through alternative medicine. We experience and respect the generosity of divinity through various health modalities. Our faith is restored, our health improves, and life begins to make sense again. Health is a basic human right. And healing is a gift that is given to us by God through a variety of channels, including doctors and other alternative practitioners. How is it that until now we did not know that there was so much on offer? That doesn't really matter, for now we are being given the chance to know.
A very big welcome to fellow South Africans and to all our viewers, and a very big hello to our new show. This is the first of its kind show, I think in South Africa, and I think I'm not exaggerating if I'm saying globally. This is a show that is covering alternative medicine and is looking at achieving two objectives. First, we want to give a face, a voice, and a platform for alternative practitioners to present their case or to showcase their abilities to the public so that people can get to know about us. Secondly, we want to inform and educate the public about other health modalities so that you've got the ability to choose or the options to choose when you're faced with challenges in your health, in your family. So this is a big breakthrough for us indeed. Now, before we go further with our show, we have looked at trying to ascertain where we stand as the public as far as knowing what alternative medicine is all about. So we conducted a street interview. Just take a look and see what you make of it.
What do you know about alternative medicine?
I have no clue. Ingaba bhuti unalo ulwazi ngendlela yonyango lwendalo?
Nalo sesulwazi.
Oh, like herbs nento green. Andazi kakhulu sisi, ndazi nge-green tea but
And nalwazi.
I know that it's natural medicine.
Not much, but what I've heard from it, it's that it's much better than like medicine you receive from the chemist. It doesn't have any alcohol in it, and it does cure people.
My view of alternative medicine is that it is natural medicine, made out of herbs and all sorts of natural things rather than the ordinary medicine that you buy from, say, a chemist or get prescribed by a doctor, that kind of thing.
Well, I believe it is just turning away from pills and any drugs, drug, medical, alcohol, or not alcohol is not a medicine. Sometimes it is, sometimes it's not. But it's just going a natural way, natural herbs, natural.
Healthy life, to live healthy. Yeah, try to eat healthy.
Yeah.
Yes,
And
yes, like lots of
with
vegetables.
exercise,
Yeah.
you know, you do some exercise regularly, daily exercises and that, which in Australia they're trying to get people to do that. And like you said, alternative medicine is something that's big there now, because a lot of clinics are doing it, and we have also Chinese medicine, which they handle with herbs and stuff. So that's also quite big in Australia. So, yeah.
Before we go further with our discussion, I would like to talk about something that actually pleasantly surprised me about America. I picked up from one prospective client of mine who wanted me to assist her with her child. She told me about how far America has gone in acknowledging and embracing alternative medicine within the health department. And I further did my own research and actually confirmed what she shared with me.
Hi, I'm Senator Tom Harkin. I believe strongly that Americans want access to health care options and alternatives. That's why I insisted that integrative medicine get a major boost in the new health reform law. Let me briefly mention the key provisions supporting integrative practitioners. First, no health plan or insurer may discriminate against any health provider acting within the scope of that provider's license or certification under applicable state law. This is the first federal provision that will ensure that insurance companies cannot unfairly discriminate against integrative health professionals practicing within the capacity of their training and licensure. Second, with regard to community health teams, licensed complementary and alternative medicine practitioners are specifically included as potential members of these patient-centered, holistic, and interdisciplinary teams. Third, the law establishes a National Healthcare Workforce Commission to examine current and projected needs in the healthcare workforce. The commission specifically includes licensed complementary and alternative medicine providers and integrative health practitioners by defining them as part of the healthcare workforce and by including them in the definition of health professionals. I included these provisions in the Affordable Care Act because this is about giving people choices, it's about improving healthcare outcomes, it's about reducing healthcare costs, because integrative healthcare is generally less invasive and less costly. And it's about treating people holistically, not just treating illness after the fact, but keeping people healthy and preventing illness. As we all know, there's a concerted effort to undermine the new health reform law, even to repeal it. Make no mistake, the fight to provide access to quality, affordable health care for all Americans has just begun. As chair of the Appropriations Subcommittee that funds health programs, and as chair of the Health, Education, Labor, and Pensions Committee that drafted the law, I intend to do everything in my power to keep America moving in a progressive direction in terms of wellness, prevention, and access to an integrative care. But I'd be the first to admit to you I can't do it alone. I need you to continue to reach out to your representatives, senators, governors, and state officials. You are the practitioners in the trenches, so you have the ability to tell the most compelling stories about the impact this new law has on the lives of real people. Your stories can emphasize the value of a true health care system, as opposed to what we've had in the past, a sick care system.
Today in our studio, we've got two guests, Shelley Rashmir, who comes from a medical background. She's a retired professional nurse. She is a daughter of a doctor, and she's got a son who is a doctor, but also a homeopathic doctor. And on my side, it's Carol Atterbury. She is a counseling therapist, and she is psychic. I want to say also something about Shelley, that she's actually a Reiki teacher. I think it's important that I should mention this, because that shows that she covers both worlds, the alternative and the conventional side. Welcome, ladies, to our show.
Thank you.
Don't you think this is a wonderful breakthrough for alternative medicine?
Well, the first, I would think. Awesome. Fantastic to say the first
Yeah.
that I've been aware of.
We're all excited. We really are excited. You've had a look at the street interviews, which was meant to just give us an idea. Of course, it's not a very comprehensive one, but it's just a very small sample, but which helps us to have some idea of where we stand as far as alternative medicines, knowledge and attitude is concerned here in South Africa. What do you make of it? It's actually interesting to make an observation like that. Don't you think so?
Yeah, well, everything on the alternative side is for us to educate, and it's wonderful to see what part the public play.
Yes.
It's what we believe in, but how much do they know?
Yes.
And therefore, it's all an education.
Yes. Well, I think that's the whole idea of having this show. It's just to give a platform to the public so that they get to know better and correctly, because some of them know, as you saw, but others have got a distorted understanding of what alternative medicine is all about. But this is a chance for us to put the record straight and to make the public know better. But now we're not going to assume that the whole public knows about alternative medicine except for what we have seen. Can you just tell us, Shelley, what is alternative medicine?
Okay. Well, alternative medicine is essentially anything other than traditional medicine, medical approach we have today. Because we were all brought up in that conservative medical approach. Even our upbringing was conservative. Nobody asked any questions. For sure. You see. So also we prefer to say complementary or integrative medicine, because it complements the body's natural healing process and it complements other treatments. So that's what, as you said, everything is what the public have experienced. How have they changed their life by being on a special diet? How have they been on a special treatments that they've had? So that's the feedback we get. That's the only way we know, is to get a feedback. It's something that we've had known for many, many centuries, that was blocked out by traditional medicine. And what we're doing now is we're bringing back that old understanding of treating the mind, the body and the soul. Whereas medicine treats the physical. Sure. What you're doing is you're treating the mental, the emotional and the spiritual. So when we are treating somebody, we're going back into the history. We're not just going back onto a condition that they have today. We're going back into a history of where those people come, your ancestors. What did they have? What did you bring into this earth plane with you as a condition? Did your mother have asthma? Now you have asthma. And as Tembi says, people treat people all the same. Meantime, that asthma is something else in the body. It's manifested as asthma.
It's actually interesting that you're tracing it back to the ancestors, because I mean,
it is.
If you think about Hippocratic oath, let alone that it stresses that let your food be your medicine and medicine be your food, but who actually trained the initial medical doctors? I mean, because those people had so much wisdom, they never worried about any type of illness because they knew what herb to use for what illness. They could tell just at the click of a finger what is wrong with the baby or the adult, and they managed. Of course, we're not saying it was perfect, but we say it originated from alternative medicine,
Yeah, sure.
and then conventional medicine improved on that,
Right.
and ended up making a whole lot of contribution towards. But then it actually is, I would say, not fair or even immoral that the origin of medicine had ended up being done away with,
Yeah, sure.
instead of enhancing it.
Yes.
But now we seem to be turning the clocks around. We're saying alternative is now complementing conventional, and yet it was conventional complementing alternative
Yes.
when it started. That's an interesting input
Observation
that,
there.
that you've come up with. Okay. Now, what do you think is the attitude of the public towards alternative medicine?
Well, I would say there's a growing awareness to the natural modalities. People are moving to a preventative lifestyle because what we are teaching now is it's a complete mind, body, soul. You're treating not just the condition, you're treating it with remedies, you're treating it with massage, you're treating it with breathing, you're treating it with diet. A lot of people just think that they can heal themselves just by going to a doctor, but they are not healing the whole body, and that's what alternative medicine is introducing, to teach the individual to treat the whole body. And I'm finding that people are asking questions because they are not, illness is increasing, conditions are increasing, and people are asking questions. Why am I not getting better? So then, from that reason, they are introduced to the individual, who then introduces them to something that they've never, ever come into contact with. Because what the doctor said, that was it. They never asked those questions.
Okay. So would you say, therefore, that they're starting to ask questions?
Certainly.
Because they are noticing that even though they're getting treatment, in some cases, there is no improvement?
There's no improvement.
Or is it also because they're starting to realize that there is so much more to health than just from one perspective? Or is it a bit of both?
Yeah, but it's also the drugs that have been introduced. People are looking for something alternative because not everybody can be treated exactly the same.
Interesting. I actually received an email. I'm not going to touch on it just yet. Now that you're talking about the side effects of drugs, of course we know that we cannot completely say it is all bad.
Yeah, not at all.
There's quite a lot that conventional medicine has done and has improved.
Totally.
But we cannot also turn a blind eye to areas where there are shortcomings as far as their practices are concerned. Alternative medicine covers quite a wide range of different health modalities. Kinesiology is one of those, but I just thought I must just touch on that because we're talking about the side effects of certain medicines.
It's only certain.
Yeah, no, I know. I also received an email from a client from overseas whose doctor, who is a qualified medical doctor, but who's practicing alternative and uses kinesiology to determine what products to recommend or dispense to her patients. And there are no side effects. Let me come to you, Carol. There is a lot of criticism on alternative medicine by medical profession. And to some extent, there are certain areas where you feel it does make sense. Okay, I wouldn't want us to pretend that there are no areas where alternative medicine has got shortcomings. We've got our own shortcomings, just like conventional has got their own shortcomings. But the main criticism that is leveled against us is we are unscientific and we have got no proof. I would like to hear what your comment is on that.
I think as far as proof goes, I think we have more than adequate proof. We really do. I mean, we have many files of many huge success stories. I think we would just be too happy if we could actually just share them with the public. I think they'd be absolutely flabbergasted. I mean, it was invisible for so long, and now for the first time we have a wonderful platform to actually show people, and we're just too willing to actually share what we have seen working, you know, in reality and helping people. I think it's amazing. So maybe we'll be allowed the platform where we can actually show and prove a lot of our theories and practicalities of our clients really improving.
Okay. I would like to take it further though. You see, when dealing with a patient, there are two phases. There's diagnosis and then there's treatment, that is the dispensing of medicines. And I see that when we're talking about alternative medicine, both from the perspective of conventional and also from our perspective, it seems to be put in one basin. And yet it's two different scenarios. Because to diagnose, it is a completely different thing from actually treating. And even with conventional, even though you find that you need to register your medicine, but you find they're always referring to the actual meds. But yet the problem starts with diagnosing, which is where conventional has some shortcomings, and which is where alternative techniques have got amazing techniques that will actually shock the public when we actually present to them, which show their abilities as far as detecting illnesses is concerned before we even get to what treatment to recommend. So in a way, therefore, it is saying there is such a huge scope for working in collaboration between these two legs of medicine. And I'm just thinking aloud here where the alternative techniques would actually be able to detect illnesses and prove, like you're saying, there's proof. There is nothing that can be claimed without proof. So we're saying this is maybe a chance where we need to prove that this is legit, that there is justification for making these claims. Would I be jumping the gun here?
No, I think we'd be very excited to actually see that day where we can actually have the opportunity to work in collaboration with somebody. I mean, for the benefit of people. I mean, this is why we're here. We're here to serve the community and to minimize people's suffering. So I think to have the opportunity to work together would be the most amazing situation to have.
I'm aware, I actually watched Dr. Oz's show the other day, where he was presenting a doctor and a medical intuitive that were actually working in collaboration. And for the benefit of those people that may not be aware, the medical intuitive has got the abilities of detecting illnesses while using their own devices of choice. But we will talk more about it when we come back after the break. Welcome back to you viewers. We're still on the question of alternative medicine and trying to make you understand it better and get to know about it more. Let me come back to you ladies. I just want to know if you think there will ever come a time, anyway, I think that question maybe sounds a bit pessimistic, but I have to ask it anyway. If you think there will ever come a time here in South Africa where we'll reach the milestones of America, where conventional and alternative has actually been encouraged to work together, do you think we're ever going to see that day coming, Charlene?
I definitely do, because everything that we do in this country, we are assisted by the minds in America, who obviously are ahead and also have advanced laboratories, have advanced money to invest, because all of this testing on product costs a huge amount of money. Spent millions, billions on research. So yes, I absolutely do. You can see the change already. As I said to you, 48 years ago, what people believed in then and what they believe in now. Definitely. But it's up to the individual, i.e. you, to put it across to the public so that they become aware of something alternative, complementary to their health. That there is something out there that can assist them in healing.
Yes. Carol, what do you think we need to do, or the public of South Africa needs to do, to help us move towards that direction?
You know, Terry, I think we need to go back to our roots in so many ways, where we actually need to listen to our bodies of what we're actually needing. And I think the more people actually explore those avenues to really go back to basics. I mean, that's basically where we started from. Like you said earlier on about the herbs and about the natural medicines and the medicine man who produced all your medicines. So I think we need to actually just listen to ourselves, listen to our intuition, and educate people. And we are so fortunate these days. We've got Google, we've got all these wonderful facilities where we can Google honey, you can Google water, you can Google anything to find out what our bodies should be having. So I think it's up to the individual themselves to educate themselves as best they can, and for us hopefully to educate them a bit further and to assist them into asking what they need from their practitioners, whether it be alternative or conventional. But I actually have a friend studying overseas at the moment in China, and his 5th year is homeopathy. So there already I see the collaboration of the alternate with the Western medicine coming together. So for me that is a huge revelation. But I think it's up to the individual themselves to educate themselves and to read up on things, get to know what's in things. Look on your ingredients list, on your foods you're eating. Get to know what your body needs and what it doesn't need. So, and then be prepared to ask your practitioner for what you're needing. So collaboration, I think, would be the most amazing day ever. We look forward to that day.
Yeah. So it's a question of
educating,
informing, testimonials and all that. But anyway, ladies, this was an interesting conversation. Thank you very much for your contribution. There is so much that the public is going to get to know about, and I'm actually excited about this show. Thank you very much for coming. Welcome back. We're still on our show, and we now have our guest who is going to introduce herself. We've invited this guest to come and present an example of cases where conventional and alternative can actually work very well together for the benefit of our clients. If you remember, when I had our first guests, we tried to look at the importance of seeing if there are no possibilities of us working together as different legs of health, that is now from conventional and from alternative. And even though most people may not be aware of these possibilities being realized, now we're presenting you with a case that you can actually see and you can hear the testimony of the person yourselves, which prove how important and that this possibility is actually realizable. I've got Marcy in front of me, and she's going to tell you in Xhosa. Hello, Marcy.
Hello, sister.
How are you?
I'm fine, thanks, and you?
I'm all right, thanks. Welcome to the show. Today I just wanted to illustrate the importance or the possibility of a relationship between conventional and alternative medicine, that it can actually work and for the benefit of our clients. So can you just tell the viewers about your problem in your own words? What happened?
Okay, igama lami nguMasi like Zondani. Into eyenzekayo ndiye ndagula kakhulu kwezi nyanga zidlulileyo. Phofu ke kule minyaka edlulileyo ndiye ndagula kakhulu, ndahamba koogqirha, ndahamba nasesibhedlela.
Ugula yintoni? Bezisithini i-symptoms zakho?
Bendigula, bendiphelelwa ngamandla. ndisihla iweight, ndingathandi nokutya. Bendihamba esibhedlele ndisiya nakoogqirha, ndisiya nasezikliniki. Into bebeye bathethe ngayo bebesithi ndineswekile eninzi kakhulu. Bazame ke uyihlisa iswekile baphinde bathi ndine-high blood inyukileyo. But iqhubekeke into yokuba ndiphela, ndiye ndibhitya, ndigula. Ndiye ndathi njengomntu osebenza apha kwa-Health Haven, kwathiwa apha kwa-Health Haven make ndijongwe ukuba ndigula yintoni kanye kanye. Baye bandijonga into endigula ngayo bafumanisa ukuba ndine-TB. Baye bandicela uba mandibuyele esibhedlele ndiyobachazela, ndiyocela uba banditshekishe i-TB. Ndihambile ke ndaya esibhedlele. Esibhedlele banditshekishile i-TB, banditicisa amathe, bekhangela apha ematheni izikhohlela, bekhangela i-TB, abayifumana. Ngelishwa ke ndiye ndaneqhuma elilapha apha entanyeni yam. Ugqirha uye wacela ke ukunditsala incindi apha kulo esithi uzawutshekisha i-TB, ukuba i-TB izawuvela apha encindini. Uye wathatha ke ilantuka incindi le wayithumela eleb, waye wafowuna efowunela eleb. Apho ke eleb kuye kwathiwa i-TB andinayo. Wabuyela kum ke endichazela into yokuba kuthiwa i-TB ayikho, so ayikho le ndithethwa kwa-Health Haven. But ndiye ndaqhubekeka ndiya ndigula. Emsebenzini baye bandihlalisa phantsi, bathi mandicele umntu ozazondibambela ngoba ndiyagula kakhulu. Bazawubhatala umntu lo uzandibambela nam bandibhatala. Ndiye ndavuya kakhulu ngoba ndiye ndafumana itshansi yokuya naseKapa kuba kusithiwa izibhedlele zapha zigodi. Ndihambile ndaya eKapa, naphaya baye banditshekisha, naphaya ayabonakala i-TB. Ndithe ke ngoku xa ndibuya, xa ndincokola nesister yase-Woma Clinic, iye yadibanisa nogqirha wapha, yathi iyacela into yokuba kule nto mna ndithanda ndisithi mna i-TB ikhona, uba kuthiwa kwa-Health Haven i-TB ndinayo and is killing me inside. Wathi ucela ugqirha ke ngoku andibhalele uba mandiye kwi-X-ray e-Provincial. So ke ndiyile e-Provincial banditshekisha, bayifumana i-TB. Ngeli xesha ke ngoku sendisiya e-Provincial sendigula kakhulu, sendinalo nephika. Baye bafumanisa uba i-TB ikhona and ke ngoku seyine-double pneumonia. Baye ke ngoku oogqirha bebebuzana uba bekuthenzeka ungatshekishwa kwi-X-ray, ndingafakwa kwi-X-ray. Babe bephikisana ke ngoku bodwa. Baye bandinika ke i-treatment, bandibhalele uba mandibuyele ekliniki ndifumane i-treatment ye-TB. Ndiye ndayifumana ke i-treatment ye-TB. Ukufumana kwam i-treatment ye-TB ndiye ndathi ndokuyitya i-treatment ye-TB ndaye ndigeyina i-weight. Nelaphika bendinalo laphela, ndaziva ngokuba ndisemandleni. I-treatment ye-TB ndiye ndayitya iinyanga eziyi-6. Nali ke ilantuka ikhadi lam lase-Woma Clinic, apho bendisitya khona i-treatment ye-TB. Kangangento yokuba ndiye ndaphinda ndakwazi ukuba mandibuyele emsebenzini ndizophangela, ngoba amandla ke ngoku ndiye ndathi emveni kokuba ndisitya i-treatment abuya amandla am, ndageyina ne-weight. Kangento yokuba mna ndiyambulela ku-Health Haven, undincedile kakhulu ngokuba if bengekho u-Health Haven ngendiba andisaphili mna, ngento engekube iyanyangeka ngoba i-TB iyanyangeka. Qha oogqirha baye abayibona bona, kodwa ke u-Health Haven uye wayibona.
Thank you, Mercy.
Okay.
Thank you. So had I not insisted that she must go and not get tired of trying, she would have been killed by TB. And yet we know TB is treatable. We know this is the area of expertise with the clinics, with conventional medicine. But the point I'm trying to drive home is that there is some margin of error in any situation. That you find you may miss something because it falls in that small area where you're making an error for whatever reason. But the fact that we, from our area of expertise, we came in and we pointed it out. Because remember, we cannot treat TB. This is the area of expertise of conventional medicine. But they missed the diagnosis. We picked up the diagnosis, but we referred back to them. So the collaboration or the combination of our ability to detect it and the ability to treat it, and that combination was actually beneficial to the client, in this case, Mercy. And look at her now. She has completed a TB treatment course, and she's fine. So the worst could have happened had we not intervened. So that is the point of. We've got a lot of other cases which we will present as we go along, but I just wanted to bring this one because TB, like I say, it's their area of expertise. Thank you very much, Mercy. Thank you. Hello, Alex. Hello, Alice.
Hello.
How are you?
I'm okay. How about you?
I'm all right. Thanks. Thank you for coming to our show. I'm sure you are aware that this month they are creating a lot of awareness around TB. TB is not supposed to be bothering us anymore. Why I'm saying that? Because it's treatable. The conventional medicine has done quite a wonderful work in managing to defeat TB. But there are still areas where there are some problems. Like when you find that sometimes they don't detect it while it is there, and in some cases they think it's there while it is not there. Because remember, symptoms of TB, you can find the same symptoms in other areas as well, like shortness of breath. It doesn't mean when you've got shortness of breath, you've got TB. You may have other illnesses that cause shortness of breath. So it is important, therefore, to know what is actually causing shortness of breath or fatigue or weight loss in each and every case. So we've chosen cases of TB, therefore, because this is a TB month where there is a lot of campaigning to create awareness around TB. But in your case, because I know you're a client of Hope Haven, I chose you, like I said, because this is the TB month, and your case happened to be a TB-related problem, as identified by them. So I would like, in your own words, to share with us your story around you and the journey you have traveled regarding the TB.
Hello, inconsistent. Ndiqale ndigula ngoJune, ndiba week ndityhafa.
uJune wa last year.
uJune 2013.
Yes.
Last year. Ndityhafa, ndiba week, ndibethelwe uvalo. Ndingakwazi ukuphefumla kakuhle. Ndiluza weight, ndingatyi. Ndahamba ndabheka ekliniki. Ekliniki bazi symptoms zethi bangikhohlelisa. Abayifumana. Ndahamba ndaya nasesibhedlele kwathiwa i-anxiety le ndinayo. Ndabuya back ndiqhubekeka ndigula ndingabikho right. Ndahamba ndaya kugqirha, lo gqirha wabona uba imiphunga yam idumbile. Wanditransferela back ekliniki mandiyothatha i-x-ray, ndayothatha i-x-ray kule kliniki. Ndayibuyisela back. Bandibuza ngezi-symptoms zento ndinayo, ndabachazela uba ndiweak, ndiyatyhafa. Ndiphefumla shortness of ndiphefumla kabuhlungu, andityi. Banditsala amagazini ababona TB, bandifaka kwitreatment ye-TB sisiba ii-symptoms ezi ze-TB.
Now, if I may ask Alice, at what stage akufakwa i-treatment ye-TB? Ufakwe ngugqirha?
Ndifakwe ngugqirha kwi-treatment ye-TB.
Okay.
Nge-symptoms ezinazo.
But esithi ayiboni kodwa symptoms
ze-TB.
All right.
yaqhubekeka yaphela inyanga ndingabikho right ndisiya ndibawesi kuba nzima nokuphakama ebhedini xa ndiphakama ebhedini ndibadizi wesi ndaqhubekeka ndabaphindela back kube ekliniki ndabachazela uba kwenzeka le nto bathi mandiqhubekeke netreatment ndaqhubekeka nayo ndaphindela back kwinyanga yesibini bandithatha bandisa kwi-X-ray bathi hayi akabikho mohluko mandiqhubekeke netreatment ye-TB zii-side effects zile treatment bandifaka kwi-treatment yesibini kwinyanga yesibini.
Now, sorry guys, bathi akukho mahluko ekudumeni kwemiphunga.
Bathi akukho mahluko, akukho change yenzekileyo emiphungeni.
Okay.
Bandifaka ke kule treatment yesibini, hayi ndaba worse ke ngokule yesibini treatment. Ndaqhubekeka phela inyanga yesithathu. Yesithathu ndaba worse kweyesine kodwa ndiyaphela ndifuna ukuphakama ebhedini kunzima amadolo atyhafile. Ndaza kwa-Health Haven bayibona ingxaki uba ikwi-pancreas and neswekile ndinayo. Bandinika ileta yoba mandibuyele back ekliniki.
Bathi yintoni kwa-Health Haven le yenza uba bathi i-pancreas nayo but ke bathi imiphunga kwenzeka ntoni?
Bathi imiphunga kukho amanzi around imiphunga lena ngamanzi. Bandinika ileta bandibuyele back ekliniki. Ekliniki bandithatha bandisa ku-X-ray. X-ray kwathiwa imiphunga yam iclear nanix. Ndaqonda ndaphela ndabuyela back kwa-Health Haven. Bandinika i-treatment ndafumana i-treatment. Ndawubona umehluko emveni kwangoko.
Alex, you've been with Alice throughout this period, so it's actually, we're very happy that you are here so that you can also give the version of what you saw in her case.
Yeah, thanks, Miss Tembi. It all started in June, but she was so worse in June, so we had to go up in clinics, hospitals. We went about 3 private doctors, but it's no change. All the 2, they just say she's got depression, she's got stress, they don't see anything. But every time she's complaining of pain in the chest and she's getting the dizziness, she can't breathe properly. They say no, that's stress. You have to get enough rest. They just give her Panadol, and sometimes they say no, we can't give you anything, we don't see. Others say you've taken too much tablets. You've got too much tablets in your blood, that's why you've got that. So the other one went to another doctor in Dapu. He said, no, what, I can't see, you've got water, you've got your lungs are swollen. So you have to go back to the clinic. You tell them to check the lungs, they are swollen the left side of your lungs. So when you took her to the clinic again, they took an X-ray, they checked her first, they said we don't see anything here. They told her to make a spit, they check up on the spit, the report came back, it's nothing. Then they have to take the blood to check everything to see what is happening. They say we can't see anything. But what we're going to do, we are going to put you on sugar treatment because we see you're developing diabetes now. Because that time her sugar level had gone beyond 10 point every time.
Where was this now? At the clinic?
At the clinic, because they had to check the blood.
Yeah, okay.
So when they checked, the sugar level is beyond because she couldn't breathe properly.
Yes.
So when they checked her, they had to give her they had to put her on diabetic treatment. So they put her on that diabetic treatment for 2 months. After 2 months, they said, no, we can see your level is stable now. We can't put you, just have to stop you on that. Then they had to take, because she kept on complaining that pain is too much in the chest. It's like there's hot water in my chest. I can't breathe properly. Then they said, what you're going to do, we can see the symptoms. We're going to put you on TB treatment. Then they put you on TB treatment. Then the first week, she was complaining on something like it's heavy here in the chest and she can't breathe properly. So I took her back to the clinic. At the clinic, they said, no, those are side effects of the medication. When you are starting it, it does like that. So you had to wait for the whole month. The second month, it's the same thing. When I took her there, because the clinic were saying, no, you have to keep taking the medication. It's gonna be fine. It does that the first 2 months, but after the third one, it's gonna be okay, but she doesn't sleep. Then I had to take her to the hospital. At the hospital, when I take her there and explain to them that she's feeling dizzy, she can't breathe properly, they said, what happened? Why don't you go back to the clinic? I explained to them the clinic, they told me she had to be on TB and diabetic treatment. They said, no, here at the hospital, we can't do anything. What we are going to give her now is only Panadol because she's already on treatment. They had to go back. At home, she sleeps for only 2 days. It becomes worse. They had to go to another hospital. We go to Livingstone. Okay, as I was saying that why to take her to Livingstone. In Livingstone, they said, we see you on TB treatment. We can't check any other thing. Here we don't do checkup. It's the clinic that is supposed to send you here. But I explained to her, I understand she's on TB treatment. But the problem is she does not have any sign besides the shortness of breath. And this problem is complaining the dizziness. The nurses said, no, those are side effects of the what? The medication. Just keep taking the medication. It's gonna be fine. You have to sit there for the whole day, then the whole night. We come out in the evening with Panadol. So we have to go back home. After 2 days, the things were worse. She's feeling like the head is spinning. And the chest is so like there's something heavy in the chest. I had to go back to the clinic. At the clinic, the nurse is saying, but as we look at you, don't look like someone who is sick with TB. You look fine. But what seems to be the problem is saying, ever since I started the treatments, now 4 months, there's nothing I can see. What exactly seems to be the problem? Then they had said, wait to see the doctor. When the doctor came in, he had to make another x-ray. He had checked the x-ray and asked her, but here you have to finish up the treatment. I can't take you out of TB treatment.
Now the treatment was for 6 months?
It's for 6 months.
Okay.
Then for the 4th month, the doctor said you have to finish up the treatment. Then I can check and see the other thing. At that time, they had to check on sugar. Because the sugar had stabilized now. But when it stabilizes for maybe 2 weeks, the 3rd week it goes again because of the problem in the chest. Then I had to bring her to Health Haven. When they put on the machine, they told us she's got a problem with the pancreas. It's enlarging. And the chest, you've got some water in the chest that they have to give us a letter to take it to the clinic. They check and see the problem is coming from, it's caused by it's not TB, it comes from the pancreas. When we took it back there, the doctors rejected the letter saying, how did they find it? For them, they haven't done this. So they had to take x-ray again. They say they don't see anything. They can't give her treatment. And we complained about the sugar because they say they see she got diabetes. They say, no, we don't see any diabetes now. We can't give you any more diabetic treatment here. You have to wait. So you had to go back to Health Havens then to try to start the treatment there, the alternative treatment. But the treatment that you got in 2 months from Health Haven compared to that one she had been getting to the clinic, it's almost a year, but she had got nothing change compared to that change she got from Health Haven in 2 months.
You felt the change within 2 months? Or?
Within a week. I see the change.
What change did you experience?
Bekunzima ukuba mandiphakame ebhedini ndisebenze ndiyaphakama ndenza yonke into ne-washing ndiyazenza and laa ntliziyo ibetha amandla isababudizi akusekho.
Ukuphefumla kona?
Ndiphefumla right.
Thank you, Alex. Thank you, Alice. When we say that there are other options, people think we just saying it, and some don't even realize how effective other alternative methods are. What we're trying to do here, we're also trying to see if we cannot bridge the gap between conventional and alternative. What I find interesting is that you did mention earlier in your testimony that the initial diagnosis from one of the doctors was that there is swelling in your lungs, which confirms what Health Haven did pick up, because Health Haven did pick up that there is water in the pleural cavity, which is why your lungs looked as though they were swollen, because the pleural cavity was filled with water, which is what caused the shortness of breath. So, but thank you very much for your contribution.
You're welcome, sister.
Thank you very much. For those that do not know, I'm hosting this show, but I'm also part of Health Haven. It is our experiences of working with our clients that has created the need for this show. So Dr. Alternative is actually the brainchild of Health Haven. I deal with a lot of cases. They range from mildly sick to very, very sick, even the worst of cases. And the majority of our clients, it's people that you find have tried everything. They're still sitting without diagnosis, and therefore there is no treatment because it's not known what is wrong with them. And our clientele base covers everybody. But what I want to talk more about, which I think is our area of specialty at Health Haven, is our ability to detect illnesses. You know, when you're suffering from symptoms, you don't know what is wrong. You have been to all the tests that have been recommended to you by a physician. You've been to specialists. You've been to all kinds of possible testing techniques, and you're still sitting with an unknown illness. There is nothing that is as worrying and as frustrating as that. So that is our area of specialty. We are in a position to detect most of these illnesses to the very cause. The reason why I am bringing the importance of a correct diagnosis, because if you don't know what the person is suffering from, you will never be able to treat that person successfully. Diagnosis is paramount in determining what treatment will actually assist that person. And that is where we specialize in. It is very important, therefore, that when you are tackling an illness, you know the diagnosis, and then you get to the treatment, but when you treat to the source, from the cause down to the symptoms. That is how we handle our treatment protocols at Health Haven. You can contact us on the numbers that are displayed on the screen. Thank you very much to you viewers. We hope this has been enlightening to you, that you know that there are options. You must know that there is hope, that you actually still have a chance of having your health back. We see you next time.